if you're working, you have group health insurance through your employer, even though you're 65, we're going to be secondary. They're going to assume the GHI, or whatever they know of as your other coverage, is primary. So what happens when you go to the doctor? The doctor says, oh, GHIs, we're secondary. Medicare, we're secondary. Well, somebody's going to be primary. And trust me, you don't want to have to go try to explain this to the people at Social Security. So it's better up front. No, you're not covered by a group health plan. And yeah, I can't stress this enough, right, Chris?
So what do you do if you put yes by mistake?
Well, if you did yes by mistake, then you contact them and say, oops, I'm a retiree, or whatever, and they can straighten it out. You know, do it while you're healthy.
Now, do they ask you this if you're applying?
If you're applying in person, they will ask you that question too. They're going to ask you the same question. And you would say no. Because what they should say, are you covered under a group health plan by an employer with more than 20 employees? I'm covered under a group health plan. I could be covered for the next number of years, but we only have 12 employees. We don't have 20 employees. And the company we use for our staff insurance won't cover me, except for secondary. Even if I got the trustees to say, cover Doug and his family on a primary basis until he retires, Oxford will not do it. Which is why I now have to go on Medicare. My wife has to go on Medicare. I got to put my kids on COBRA, because they're entitled to another 9-10 months. All because we don't have enough employees. So this is the trick question. I really wanted to get this through. Okay, this is an idea of the first letter you get. Your Medicare Part A and B medical insurance will start November 2018. This is one of the letters. This means you did it right. Okay? You get a Medicare card in 2 weeks. Then you get another letter, which I don't think I got, which says, you know, your Medicare premium is $134. But this is a letter I did get, the dreaded IRMA letter. Okay? So what the IRMA letter says, it explains it and all. It says, based on the information we have, you will pay $53.50 for the Medicare Part B income-related monthly adjustment amount effective November 2018. This is the type of letter we need to get that IRMA reimbursed from the city if you're not taking Social Security. This is what it will say. Especially if you're new to Medicare this year, this is the letter we need. And again, this is why I put it here.
And if we don't have it?
If you don't have it, email me. I'll give you the screen, the link to the screen where you can go into My Social Security and get the same information. I should have put it in, but I completely forgot. Because that I remember. I remembered the letter. I couldn't remember where I put the Medicare card.
I received the first letter, and I got a second, and I think a third.
Yeah.
Readjusting IRMA.
Save all of them.
All of them.
Save, because, yeah, they send the first one. You're going to pay $134 a month. Then they send another one saying, oh, you might have to pay IRMA. And then they say, well, you're going to pay X amount for IRMA. And then they say, oh, we changed the IRMA. So save everything. Now, if you've gotten these letters, you know it's not just one page. You know, it's 6 pages in excruciating detail that nobody can understand of how they figured out that based upon your adjusted, of your tax return from 2 years ago, that this is what you're going to pay.
Now, wouldn't you know that though, without this letter, by how much you paid? Like you're saying, you should have paid $134 a month
Right.
for Medicare.
Right.
But I know I've paid much more than that.
Right,
They give
right.
me quarterly.
Yeah.
And it's much more than $100.
Right, but what
So
I'm saying,
wouldn't I be eligible for IRMA then?
yes, you can go for IRMA, but the city wants something to say how much are you supposed to pay.
Wouldn't the bill show that?
We can probably get through with the bill. If there's no other thing, we'll throw ourselves on the mercy of Linda. And we'll offer to take her to lunch again or something. and say, oh, by the way, take care of this one. Yeah. If you didn't get either letter, how long ago did you apply for Medicare? Oh, then, they automatically sent you the card? Okay, so you were on disability before? Okay. You've got something, you can go onto the Social Security website and get what your Medicare costs are. If that's the case where you need that link, just email me, and I'll find the link, or I'll print the page off and send it to you so you know where it is. I haven't needed it, so I haven't, I don't know that link down by heart yet.
Yeah, I had a problem. The Part B, even though I have the Part A, didn't take effect. And all of a sudden I was getting all these bills for the 20%. So I had to call Emblem, GHI, and they had me on the phone for a half hour, and they did this thing called the Medicare crossover.
Right, the crossover, right.
So,
Yeah, now sometimes it gets screwed up. It should happen automatically when the city tells them that you're Medicare.
yeah,
They should automatically do that.
yeah, they didn't do it. So what happens, they told me ignore the bills.
Know the
They're
bills and
gonna
we'll reprocess it.
reprocess all those claims for
Yeah,
labs and
right.
everything.
Because claims go electronically to Medicare
Yeah,
from the provider. And then they know, in their system, they know who your secondary coverage is. So they then send it electronically as a crossover. They call it crossover, or the 20% claim. They send it automatically electronically there. So if something doesn't tell them, you know, it happens. And of course it happened to you.
yeah.
So that's the letter there. Oh, more information. Next year, you'll probably get this book, Medicare and You, for each year. It's online on the Medicare.gov if you want to see what it is. It basically is all the stuff that we talked about, and a lot of other gobbledygook. For whatever reason, they mail it to every Medicare beneficiary. We got the one from my mother-in-law, I think, last week. And so it's somewhere, but when you look and see, well, gee, what's the premium going to be next year? They say, we don't know what the premium for next year is yet, so why do the book? I haven't been able to find it. I think it's going to stay the same, but I'm not going to be quoted on it, because I really haven't found it anywhere yet. I put in the CSA News every January a little article about what these numbers are for that year. So in January 2019, you'll see that chart updated for the two charts, the one for B and the one for D. 1-800-MEDICARE, Medicare.com. On Medicare.gov, which is the official site, there's a link there to something like, is my service covered? If you don't know whether Medicare will pay for something or not, you can just go and type in what it is, and it'll give you the coverage rules for the procedures. So you need to take a Medicare insurance plan. No, don't buy anything. Don't let them sell you anything. Don't let your kids tell you to buy something else. The Medicare open enrollment period is now. So this is where, if you were in what they call traditional Medicare, the 80-20, or you're in the Medicare Advantage plan, and HMO like HIP, you can change it this time of year to have it take effect in January. It's from October 15th to December 7th. That's why you see all the ads. You see Emblem, you see Humana, you see Oscar, you see whoever. All the ones that are authorized in the market, they're running ads constantly. Social Security sent you the bill. We talked about that. So,
Question, Doug.
yeah, oh,
For open enrollment,
Yes.
they're clear with A and B with Medicare
Yeah.
and GHI
Yeah.
with the city.
Right.
We don't have
no,
to-
if you're fine with traditional Medicare, the 80-20, with the city coverage that you don't pay for, then you're good to go. The AARP Medicare Supplement, to give you an idea of the cost, the AAR Medicare Supplement Plan is going up to, the best plan they have, is going up to $308 a month next year. It's $292 or so now. So that's $300 a month times 12 that you're not paying. So what's the value of it? That's what the value is. You know, plus anything you pay for Part B is coming back to you. So that you know, you don't need to buy anything else. Don't let them sell you anything else. Don't let them sell you a Part D plan when you go, if you go into Social Security to sign up for Medicare. You don't need it. And you can only be in one Medicare Part D drug plan. Because Medicare subsidizes about 30% of the cost of the plan. They're smart enough to do a comparison. And they'll say, here's what his drug plan, you know, AARP drug plan, here's GHI drug plan. Do a cross match. If a Social Security number's in both, they kick you out of one of the plans. It may not just be the drug plan. They may kick you out of the entire GHI coverage, the medical and the drug plan. So you can use the other one. There's no rhyme or reason which one they keep you in. But if you're in, I know that if you're in like a TRICARE or something to do with the federal government, and you're in another plan, they always kick you out of the federal government plan. For some reason. Yes?
What I just don't understand, I'm a CSA retired.
Right.
Is my husband still on my GHI when we go
Yes.
to Medicare?
Yes.
So,
Now, is he, oh, okay.
so he would still be on?
He would still be on. Now, if you're Medicare eligible and he's not, I'm not making judgments.
We both are.
Oh, you both are, okay. Yes, you'll still be on your coverage.
Okay.
So here's my question, Don. A pension statement
Right,
shows that there's a deduction
for $220.
$202.
Okay, right, that's the
Month.
family drug plan, right. That's gonna go
So
to,
that's different? So I'm gonna pay the Medicaid?
you're gonna pay the Medicare
Part
and all
B.
that, and you're gonna pay 133 times 2 for the pension.
I'm sorry, so I'm paying
Okay.
for drugs twice?
Yes,
Yes.
yes, because you're rich.
Oh, why?
Huh?
Why?
Because they look at the income and, you know, it helps them subsidize the drug plan.
Right, which is the Medicare
Yeah,
Part D.
the Medicare Part